Welcome back. We move now into the early intervention panel, and I'll begin by introducing our panel's chair, Janet Jukes, and then I'll hand it over to Janet to introduce the panellists. There will be an opportunity for questions at the end, and that will be facilitated by some volunteers with roving mics. Janet will be known to many of the delegates in this room today because of her extensive experiences in the human services sector. She's been the Executive Officer of YACVIC, has worked as an academic, and has also worked across a wide range of areas, including youth and family services, homelessness, family violence, and children's rights. Her current role at the Salvation Army involves oversight of projects that relate to all areas she is passionate about: youth services, housing support, education, crisis accommodation, drug and alcohol services, just to name a few. Janet, I'll pass it over to you.
Thank you. I'd just like to begin by acknowledging the traditional owners of the land, the Wurundjeri people of the Kulin Nations, and I'd like to thank them for their custodianship of the land that we're meeting on today, and pledge my willingness to partner with them as we move forward in reconciliation. Today we're going to talk about early intervention. We're going to run this session as a Q&A, and hopefully quite a lot of participation from all of you. We've got a lot of roving mics. The questions aren't going to be at the end. In fact, they are the session. We've got a panel of distinguished experts in various fields, and all of them have had or have something to say about early intervention, so we're really lucky to have them here to help us discuss this really important issue. So the process of today is very much a Q&A session. If anyone's seen the Q&A program on SBS, then we're going to run it a bit like that, although I'm not Tony Eastley. Don't sound like him or look like him. But hopefully we can still have a really good session. Let me introduce the panel members to begin with, shall we? So the first panel member I'm going to introduce is Phil. You need to put your hand up, Phil. Dr. Phil Crane. Phil's a Queenslander, but we don't hold it against him. He's a senior lecturer in youth services, or services to young people, within the School of Public Health and Social Work at the Queensland University of Technology. Phil's academic interest centres on human services practice, particularly in vulnerable young people. And he's had a lot to say about early intervention over the years, and we're really pleased to have you down here. Thanks, Phil, for coming down. Professor Stephen Lamb is Professor of Education and Deputy Director at the Centre for Research on Education Systems at the University of Melbourne. He has a distinguished record of contribution to educational research and policy over the last 25 years, and this includes a landmark study on the impact of 25 years of school reform on student achievement and inequality. Unfortunately, Shelley Mallet can't be here today, so that's why your program's a little bit different. But we've got Jenny Promos. So Jenny is known to many of you, I think, through her work at the Centre for Adolescent Health over the years. She's a paediatrician and adolescent health physician who works as the principal medical advisor in the Strategy and Review Group of the Department of Education and Early Childhood Development. Jenny's role as head of the Health and Wellbeing Division encompasses the provision of expert advice to inform policy and program development across government through a focus on outcomes and evidence using a life course and socio-environmental approach. Sandra Radovini is a consultant psychiatrist, with over 25 years clinical experience in mental health in child, adolescent, youth and adult psychiatry. Sandra is the director of Mindful, the Victorian statewide teaching and training unit hosting postgraduate courses, professional forums, workshops, short courses for clinicians working with children and adolescent health services, as well as clinicians working in other sectors, for example, education, welfare and private practice, and more recently is involved with Headspace. And hopefully we can hear a little bit more about Headspace and its work in early intervention today. And Paul Bird has stepped in at the last minute for Espita Wright, who can't make it here today because of a family issue. Paul's the CEO of youth support advocacy service YSAS, and was previously the CEO of Mission Australia here in Victoria. And we welcome you here today, Paul for stepping in. And finally, Pete Jacobson. Pete is Project Officer for the Barwon Youth Partnership Project, which is also, he's employed by the Department of Education Early Childhood Development, and he has a background in family services and coordinator of youth and family services in an NGO. He's a senior policy advisor for family services at DHS. So welcome, Pete, and thanks also for stepping up at the very, very last minute, about an hour ago, when I made him come up and join us. So we'll cut him a bit of slack, I think. All right, so we might begin with our first question. Well, actually, and before we do that, we'll just ask, I'll set the scene a little bit. So, what is early intervention, and what do we know about it, and what don't we know? The idea that it's better to intervene early to help young people before problems have become entrenched has become a strong argument in the Australian social policy debate, and it also makes pretty good sense, wouldn't you think? In the homelessness field, early intervention was recognised in the mid-90s as a new and promising policy perspective. The establishment of the Reconnect program in 1999 was based on deploying workers to undertake early intervention work with young people and their families in order to repair family breakdown where possible and prevent young people leaving their schools and communities and sliding further into homelessness. In the federal government's white paper, The Road Home, launched in 2008, early intervention is highlighted as a key position called turning off the tap. Reconnect was earmarked for expansion, and then funds for this expansion were channelled into the other COEG reform processes, national partnership agreements. However, the program wasn't handed over to the states for further development. Nearly 2 years on, next to nothing has been done, or 3 years now, next to nothing's been done to implement early intervention for homeless young people. Limited resources have been increasingly targeted, and this has meant that the flexibility to respond earlier with whatever resources are necessary to head off at the problem are simply not available, if they ever were. Has this policy focus stalled? Early intervention is broadly the same concept across sectors and program areas. However, there are some different understandings relative to the issue. But we don't have a common language of early intervention, and we need to. Some fields are still disputing the value of early intervention strategies. A move to more early intervention programs could eventually mean a shift of resources to that end. This is hard to do given the current extent of unmet need. So how do we conceptualise early intervention? Is it a form of service delivery, or is it a combination of service delivery or community capacity building? Is it also a bridge between universal and specialist service systems and programs? There may be key intervention points in the adolescent life that are important for identifying effective response settings. For example, all young people spend some of their adolescent years in schools, and consequently schools are an important institutional setting where the timely identification of issues is possible. As we think about early intervention, there are also issues that we need to keep in mind. For example, we need to be wary not to create systems creep. We don't want to intervene when we don't have to and would never have needed to. Access is an issue. Because of limited funding for human services in all specialist program areas, many programs are targeted towards those in most need. This has resulted in few opportunities for young people and their families to access effective and responsible programs when programs first begin to emerge. Thus, problems often become entrenched and more complex before assistance can be provided. It's hard to run an early intervention program without it slipping into more complex support, simply because our service system's under a lot of demand. So we've got some questions we need to answer. What does early intervention look like in practice for young people and for service delivery? Can we identify some common principles for early intervention for young people that make sense across service systems and program areas? How can early intervention be coordinated so that young people and their needs are central? What can we learn from some of the excellent early intervention programs that are currently running in various service systems? And we heard some of them in the session before. And what do each each of us, the direct service providers, policymakers, academics and funders need to do to move early intervention from a policy rhetoric to a reality. So there's the challenge of our discussion today. Hopefully that's given you all a bit of food for thought. We might begin with our first question.
My question is, some people talk about putting barriers at the top of the cliff rather than at the ambulances at the bottom. So is early intervention really a parachute for young people as they go over?
So what's early intervention? Who's up for the challenge? Go on, Phil. I know you want to.
Okay. The first thing that comes to mind for me is that early intervention of itself doesn't really tell us a lot. You need to sort of go early intervention into what? Intervention is you do something, early is you do it at a presumably earlier than you might otherwise do it, but we really have to say into what, because early intervention into child abuse might look very, very different from what early intervention into another sort of social issue. You know, early intervention into driving badly might look very different again. So it seems to me that there is some sense in saying, well, early intervention into homelessness, you can start to talk about that because you can have an analysis of a particular issue that crops up. The interesting thing around young people is that there can be quite a lot of confluence, quite a lot of lining up between early intervention in some areas and early intervention in others. And I think teasing out those linkages becomes really important. The other thing I do with early intervention in terms of defining it is distinguish it from broad prevention. And I think one of the concerns about early intervention, which you mentioned in your sort of framing of this, is that there can be sometimes fears that early intervention will result in a withdrawal of resources from real high-end need, where there's most probably not sufficient resources anyway. And so I think positioning early intervention as being, in a sense, having some preventive effect, but not being the same as broad population-based prevention, where you're really doing things to try and create an environment where people don't experience issues in the first place. I think that's a really important it's really important to distinguish those, and then in turn to distinguish early intervention from the much more, and you referred to the cliff metaphor, to the bottom of the cliff one, to the bottom of the cliff services, which are where people are in, have very substantial and somewhat difficult to budge issues, and whether those be in, mental health or homelessness or some other area. So they would be just a couple of opening thoughts. In terms of the metaphor, I don't think the cliff one is that useful. It sort of has some recognition that, yes, you're intervening earlier, but I think there's and you alluded to the notion of early intervention being a bridge. To some extent, I think it's best defined by the institutional space it occupies. And by that I mean that early intervention sits inevitably, I think, between people's everyday mainstream lives, which we have mainstream institutions for, and with young people, those are family, school, community engagement, and maybe vocational training, and maybe some part-time work, and specialist responses to specific issues, and that early intervention sits between those. And I think there's been some confusion in various policy circles between thinking of early intervention is just what should happen in the mainstream, and early intervention is something that is a specialist service response of its own. And I actually think it's got characteristics of both those and works between them. It's the glue, it's the space that allows us to respond in a non-stigmatising way and a non-escalating way to people when they are experiencing issues that could end up in high-end need if something isn't done.
Obviously in mental health that's a big part of the conversation. Do you want to add to that?
Thank you. Thanks. I guess in mental health we've often distinguished between early in life versus early in illness versus early in episode of care. And so I think I echo Phil's comments about, in this discussion, needing to think about early in what. So early in life is, of course, thinking about service delivery that is for children or even maternal perinatal care, and trying to spot perhaps some risk factors and trying to intervene early in that space. Early in episode of care is thinking about young people, or in fact children, who are beginning to have more than the odd transient problem, and how do you spot those and how do you deliver an effective intervention at an earlier stage before problems are entrenched. It's the old, a stitch in time metaphor. And I think the early in episode of care refers to when people have more entrenched difficulties or recurrent difficulties. How can you assist as things perhaps start to relapse or things start to get worse again? And how can you help people to access assistance, or how can assistance be available in as easy, accessible, non-stigmatising way?
Hi, thanks for those comments. Although I agree that it's useful to think with early intervention, early in what, in my practice over the years I've seen a move away from generalist youth services, and I've more and more see young people falling through the gaps because we're too specific. Funding bodies want to fund services that deal with things specific, and I'm telling you, young people are hurting. They're not getting the information that they need.
Have we got an over-engineered, I've been heard to say we do, but do we have an over-engineered service system, Paul, do you think?
I think for all of us that work in crisis services, I think, and see the damage that young and older people are in, I think we all yearn for the day that we can work more upstream before they get into that situation. So I think intervening earlier is crucial. I think the question is absolutely right, though. I think we all tend to work in our own service systems. We're all funded to different contracts that have different, usually, outputs. The question is, I think, on the ground, I think we all try and work very well together to try and link people up to services. But I'd love to see early intervention where there is a natural, if you like, at least navigation of service. And I think that's what Headspace does as one example. I think it allows an accessibility, but I think it allows a Headspace centre, both virtually and through the physical centre, to actually start linking people up into what is actually available in their area in a way that provides a list of information, if not support. So I completely agree. I think intervening early can actually try and provide some sense of what the service system could look like in the future. And for those of us that work in a stream, I think it can enable that navigation to happen at an earlier stage before somebody gets into a situation where it's much more difficult for them to navigate.
Should we try another question? You want to go, Phil? Go on.
Just one point. What I think is really important about your question, I think it's a great one, is that if you create a different service system for every early intervention into what, you just replicate the incredibly fragmented systems that we have. So just because you need to be clear conceptually about early intervention to what doesn't mean that you create a service system that is fragmented like that. In fact, we need the very thing that you've mentioned, which is where is the good generalist support available for young people when things are beginning to not go so well in one of many different arenas. And good early intervention work won't presume the cluster of issues that a young person brings. And so it does need to be very holistic.
Isn't early intervention just about working with kids from primary school?
Sorry, what was that?
Working with kids younger.
Look, I'm happy to answer that. As, I guess, a policymaker and one that works in a department that is responsible for the educational and wellbeing needs of lots of children in this state, in fact all the children in this state, your children and young people, I think the approach that we take is one that is informed by the younger age groups, and I have to say in Victoria we have a very fantastic in many ways opportunity where we do start with children really from birth, now that we have early childhood as well in the department, and so we do have an opportunity to really reconceptualise the way we approach children, young people and their development and their positive development. So I do think that we have an opportunity to ensure that children don't fall through the gaps very much earlier, at a time when we do have access to the vast majority of children in and through schools. Now, we're still in the process of trying to work out what that means and what responsibility we have and how we're going to do that. But we have models that work very well in early childhood, so early intervention is a very well established discipline and service system response in early childhood. And there are, I guess, learnings from that we can apply to the older age groups. And some of those learnings are the things that we've already said, a holistic approach, a child and family-centred approach, really using a non-stigmatised service system and saying, how can we identify these children, how do we identify them, and develop a multidisciplinary response around them in a coordinated way that brings the family and puts the child at centre and it acknowledges and it incorporates the child and the family view into that. So we're in the process of trying to still develop that, and I do have to, obviously the reason why we're all here is partly because of youth partnerships, recognising that lots of children and young people have fallen through the gaps and that we are developing some sort of service system response to try and re-engage young people, but we're still also trying to work out what that means for us, both in primary school and the middle years and as we go through. So it's early days for us, I think, still, but I do think we do believe that we have an opportunity to actually intervene earlier if we can.
It's an interesting discussion that I think we've been having for about a decade in the youth sector. I mean, when I was at YACVIC as the CEO, we were talking about whether or not more resources should be put into preschool children, not just primary school. And we know that the federal government's announced screening, mental health screening for 3-year-olds. So that's a interesting, taking that policy discussion. I actually sat in one forum around education where one of the speakers said it's all over by the time they hit school. If you don't get them before school, then it's all, it's done and dusted. It's all over. Pete, do you want to tell us a little bit about what's happening down in Geelong? Because that's a really interesting project. That's a partnership project that's looking at some of that screening, I guess, picking up, testing and picking up people and then trying to design an early intervention response around that.
Sure. Look, I'll start off with a caveat that I've been thrown in at the very last minute here. Mike Kelly, who's the CEO of Time for Youth, who's the lead agency for what we call the Geelong project, was unable to get here. So suffice to say, he won't be getting a Christmas card this year. The Geelong project is an initiative that's been born out of about 3 years of effort down in the Geelong region, led by Time for Youth with Barwon Youth, who are two of our major community service organisations down there, with Swinburne University, alongside Department of Education, Headspace, Geelong Region Land and Department of Human Services. Essentially, to give a quick snapshot of what the Geelong project is, it's to trial an early identification and intervention model with the purpose of reducing youth homelessness in Geelong. Now, one of the, underpinning constructs behind the Geelong project has been a development of a community of school and support services. So that has the potential to sound a little trite, but it actually is quite meaningful and purposeful in Geelong. It really means something to the guys who have been 3 years in the development of this. And essentially it is, if we want to become better at having a cohesive response to young people earlier and to divert them away from tertiary level services, that we need to be able to work together as a community. There's, I guess, two streams of effort really that underpin the Geelong project. One is around the systemic development. So that is looking at things such as we have undertaken a student needs survey. So we're very, very extremely fortunate in Geelong to have the assistance and support of Associate Professor David McKenzie from Swinburne University, who's one of the preeminent youth homelessness academics in the country and I dare say the world. who has provided us with some really robust evaluation methods to support the project. So the Student Needs Survey has been a census survey of every young person in the Barwon catchment of the Barwon Southwest region in a government school, and provides a data profile in terms of understanding risk, the number of young people at risk of homelessness, at risk of family conflict, their risk and resilience scales, etc. So we actually have a fantastic opportunity down in Geelong to build some really strong evidence as to where young people are actually at the moment, which I think is quite exciting. Part of the other systemic development methods for the Geelong project are looking at developing what we're calling the e-wellbeing toolbox. So essentially building a system where when a young person makes contact with any of the youth support services or schools in our region, that we actually have a way of understanding their intersection with the multiplicity of services, etc., that they might hit during a 12-month period of their life. That we're having some common language, some common tools across those range of sectors, which are health and education and DHS, etc., around screening, around assessment, around referral pathways, etc. These all need to be, of course, underpinned by formalised partnerships. So there's a lot of that sort of prosaic work that sits behind that. The other element of the Geelong project, so we have the systemic development that kind of underpins that. We have the opportunity through funding received through the DHS Innovation Action Fund to trial a new workforce, essentially, of 7 workers who are an early intervention team. They're made up of people with skills from Youth Connections, alcohol and other drugs, youth health, Indigenous, family support workers, disability support workers, and generic youth workers, who will be formed together to actually be the team that responds to these young people who are identified as at risk of homelessness earlier through the new tools that we'll be implementing through the trial, and then looking at some sort of broader data at the end of that in terms of, well, if we utilise these tools where we can identify earlier through school, keep them connected with their homes, keep them connected with the family, keep them connected with education, we can actually see through that coordinated approach we can have better outcomes for those young people at the end, and by comparison we'll also have a picture of young people who haven't been through the early intervention team but have gone through the existing service system as it's structured at the moment, to see whether or not we can actually make a difference for homelessness.
It's kind of a fascinating project from my perspective, because if it works, then you could say in 5 or 10 years' time we'll have fewer young people from the Barwon region in youth justice programs, fewer young people from the Barwon region in mental health services, or adults, young adults, I guess is what I'm saying. Fewer young people or young adults, lower teen pregnancies, all of those other indicators that we might suggest might indicate people not tracking too well in their life. So watch this space, I think. But how is it not systems creep? How's it not kind of going, oh, well, you know, here's some at-risk young people, because we're doing a bit of survey and we've decided that there's a whole lot of at-risk young people here. We've got their names and addresses and the families that they're in, because we've got the information through school. Now we're going to put in place some programs. How's that not the system creeping into people's lives?
Well, the metrics and tools that they're using in terms of identification are validated assessment tools in terms of identifying young people at risk of homelessness. So that's not to say that there's not a whole range of young people at risk across many metrics that sit that. So I guess our focus, and this goes back to this conversation at the start in terms of what we mean by early intervention, this project is really early intervention within the homelessness space. I guess it's not going to pick up all young people at risk, but we're having a specific focus in terms of those identified at risk of soon to enter the homelessness service, and seeing if we can actually divert them from that and keep them connected.
And I guess that kind of links quite a good segue in, because I mean, one of the very good things about this project, I think, is there's a lot of research behind it. So we'll be able to actually see. I mean, one of the issues, who actually has you can put your hand up if you want to, who actually invests in evaluation when you're setting up a new program from the beginning, from the conceptualisation level all the way through, and publishes a report at the end of it? See, every hand, I mean, you want to, don't you? But it's very hard to get money to do it. So you want to, but you can't always do it. And also, it's not necessarily feasible when you're running, a whole lot of programs. And you've got to get it on the ground, and you've got to get results in 3 months, like the homelessness action projects that are out at the moment. They've got to get results by August, I think, and they got the money in the bank last month. So that's an early intervention strategy, isn't it?
So my question is that early intervention means different things to different people and different things to different program areas. So given that, how do we get some general understanding of early intervention that can then be applied and adopted more broadly and therefore be more successful in getting those approaches implemented and funded?
So we have lots of different understandings about homelessness. That's my tardiness and pressing the button. Different understandings about homelessness, and certainly I think that different sectors understand early intervention in different ways. Does any panel member want to talk about that? Could take it a next step. So, for example, about a year ago, I went along to a conference around youth mental health, and it seemed to me like everyone was pitching any youth mental health intervention as an early intervention. And the frame of that was because if you intervene, well, the theory is that if you intervene when people are young, in fact, when they first have their first episode of mental illness, and you intervene effectively, then you're preventing mental illness in adulthood. So it's an early intervention. Is that how we is that a useful way of conceptualising early intervention? Is any youth intervention, whether it's in homelessness or anywhere else, an early intervention?
Janet, I think that's one way of thinking about it, and if you're going to a conference that is a mental health conference, then indeed thinking of the top of the pyramid, the tertiary services, then anything that sits below that is earlier and preferable if you can. I think, though, as I was saying earlier, also people have come to think about, well, what are the missed opportunities? So what about in childhood, as Jenny was saying? What about, can you pick or usually, I'll put it the other way around, you often can pick the children who are running into difficulties, even if you're not sure what those difficulties might be or how to clearly define them. And is there a way that you can intervene there to try and prevent things getting worse? I think also coming back to your earlier point, the problem for many young people isn't the issue of over-servicing. It's actually that young people are often reluctant help seekers. So, in fact, how do we design our services that will encourage young people to seek help? Or how do we make it easy? How do we make our services, particularly coming from a mental health or drug and alcohol setting, to be non-stigmatising? Because I think those things get in the way of accessing help early. And we are beginning to, for a while now, we've been trying to think about those things, and the Headspace model is one of those models that tries to be non-stigmatising. A young person could come along to a Headspace centre with a range of problem that isn't clearly defined as drug and alcohol or mental health. It could be anything really, from something relatively minor. The other aspect in designing services is seeking a young person's voice in how do you design a service that a young person feels is youth friendly. And again, young people have great ideas if we only stop and ask them.
Go Go on, Stephen.
Yeah, look, every year we publish with the Foundation for Young Australians a publication called How Young People Are Faring. And it's post-school, and it's in the 15 to 24-year age group, and we're looking at the numbers who are struggling, basically, either being unemployed or marginalised in various ways. And for us within the education community in our research, in some respects those patterns need to be addressed earlier. So from our point of view, early intervention, because those sorts of patterns we view as part of a failure of schools. If young people have left, they haven't completed their school certificates, they're going to struggle, some for the various reasons we've talked about or others have talked about. It is a failure of the school system, in a sense, to have identified and been able to address the needs earlier on. Now, we have a strong focus in a range of schools which have had particularly effective programs, and there's a variety of we can measure effectiveness in a variety of ways, where they have had early intervention programs, both in secondary in terms of trying to deal with kids who are coming in from a variety of primary schools into high schools. If schools leave it till the end, till providing this variety of programs and having to mop up basically what has been a failure along the way, then again it's too late. The effort has to come in earlier, even though our funding is geared the other way. And ultimately it means at the beginning of primary school and earlier. There are developing around this state and in South Australia, I've seen some more extended service models that flow back from birth right the way through, particularly in disadvantaged communities. And so that's where we sort of see the focus of early intervention. I notice in Victoria the Prep to 2 initiative, for example, which occurs when kids are assessed in prep. There's a lot of funding goes in at this point to reduce class sizes, have focused reading recovery, trying to and deal with the fact that there's a diversity of need that comes in. Kids are at different points of learning. The focus there is to try and even that up. And Victoria does actually exceptionally well over the first few years. My problem in part with the early intervention is that it's often set to a period, set to a program, comes at a point and needs to be sustained. And we see growing gaps in school in large part because what we've set up initially is not sustained. So early intervention is extremely important. Economists keep pointing to this right around the world, that you can look at it in terms of later outcomes, not only cognitive outcomes, not only in terms of student achievement, but Heckman, the Nobel Prize winner, his work on early intervention indicated that the cost of that accelerates as you move along, the cost of trying to intervene.
So is early intervention the Band-Aid, the quick and dirty fix-up, and then you're back on track? Is that?
No, I think it is well formed and framed as an approach, and it has to happen. It just needs that you need to look at some of these programs and think about how they can be sustained. For example, reading recovery is a program that operates in grade 1. It's identified for kids who've fallen behind, and schools, every government primary school is given funds to support that program. But the research evidence suggests that the effects start to wear off by about grade 4, and it only comes in at 1 year level. So the arguments are there for sustained effort as well as early intervention.
Is that early intervention or is that just good teaching?
No, that program is quite specific. You can imagine coming into prep, given the differences in kids' experience up to that point of time, some are in a position where they can already read. They've already got an association and a familiarity with numbers, with words, and their capacity to frame sentences and use the language very well. And others, a book is a very foreign thing, and reading is a very foreign activity. And there's a large gap, and it's a matter of what can we do to bring a group of kids up to a common standard, a common level, so that all kids have the skills to be able to do those basic things. And you need, therefore, a lot of resourcing going in at this point to be able to do that in those early years. The problem in part is that the funding that goes into government schools at the present moment is not well targeted, because the funding model treats every school as having need, and every school in a sense does have need, But you go to some primary schools in some of the northern suburbs, and the need is much greater than elsewhere, but they only get the same level of funds. So there are problems around the way that the intervention is conceptualised and resourced.
Now I feel I can see you itching to make a comment.
I think between what Sandra said and what Stephen said, there's a really interesting sort of thematic in there somewhere, and that's to what extent is early intervention a model of service delivery, like the reading support program. There's something very specific, very targeted, which absolutely has to be done in a way that creates some long-lasting effect, versus what Sandra was pointing out, which I think is really important, in that young people often don't actually access a range of supports, and there's often a reluctance. And I think sitting in between that is this issue of the actual institutional cultures we create for young people to engage with. So if we reduce early intervention to specific models of service, which is perfectly legitimate to have those, I'm not arguing against them, but if we need to be looking at the broader cultural environment in which young people are living, and where it becomes possible for them to voluntarily seek assistance or be willing to accept support. And unless we do that, we're relying on strategies which are very much imposed and which lose some of the point of early intervention, which is that it's not really meant to be another set of highly specialised points of service delivery. The point of early intervention is it leaves people's lives authentic in terms of supporting their natural assets and resources to be able to be supported and developed to assist them have good lives.
When we were talking earlier, Phil, you were talking about the idea that perhaps early intervention is that space between the universal service systems, education system, the health system, that provides services for everybody, and the specialist service system. And the idea is early intervention is about bouncing people back out into the universal service system. Now, the universal service system might have specialist programs within it, but it's actually about recognising that there are times you don't want young people becoming deeply embedded in any of our services systems, especially homelessness.
That's right.
So an example of that, is the idea of reconciling young people back into their communities and their families, so that they don't become somebody who ends up living in the refuges and bouncing around at the homelessness service system.
And making sure that our institutions aren't subtly booting young people into the specialist service space. Classic example being how, as we've become incredibly concerned about literacy and outcomes from schooling, so we've placed significant subtle incentives at the schools level to not really want to have the fullest diversity of students in many student bodies. So there are some subtle but very powerful dynamics which nudge, nudge, wink, wink, you're not really welcome here. Which are, in a sense, bumping young people out of mainstream engagements, because the mainstream system often isn't prepared to do the type of changes it needs to do in order to, for example, accommodate a wider diversity of young people for a much longer period in education than we did 30 years ago. And rather than just establish a set of alternative education places where the young people who are at risk go, and leave mainstream education to be limiting in terms of its capacity to include all of those young people, I think we have to make sure that early intervention doesn't simply become a tool or a set of strategies which are there and excuse our institutions, whether they be the institutions of family, community life or schooling, to not really be ones that are effectively meeting the needs of a diversity of young people.
Now, Jenny, I know you've got something you'd like to say, but I'm just going to go to a question from the floor, and then hopefully you'll get a chance to... the purple cardigan and just behind.
Thank you. I was just had a question around funding and whether or not you believe the current funding mechanisms and streams allow for early intervention. And if so, if you can give some creative and innovative examples, but if not, if you could provide some examples of how you think that maybe we could change that system to better fund early intervention.
Surprise, surprise, we're 8 minutes out from the end of the session. We're talking about money. Should have got there earlier, really, shouldn't we? Jenny, do you want to have a go at that one?
Oh, my God.
Or is there somebody else who'd like to have a go at the funding issue? Paul?
Yeah, dear to my heart as well. I suspect a lot of it is because governments feel quite uncomfortable in really approaching an intervention because we've got scarce resources, but it's also because have we actually put the outcomes and outputs we'd like to see attached to that money as well. So I think a lot of government departments say, currently we're funding on outputs, X number of people through X number of services. If we move towards early intervention, how does that look from a contract management point of view? And maybe it's up to us to say, like they did in South Australia with ICANN, which encourages schools to work with non-profit organisations around alternative education, is actually say this is what we can provide for you and this is the outcomes we're actually looking for. I think it's always best to put that to government and actually us really advise them on what could be achieved, and I think that's I think it could be a key driver for us. So the economics are obvious, and I think everyone knows that for every dollar you spend on an intervention, you're getting something like $7 back. I don't think that's the argument. The argument is how can we embed it into some of the policy context, but also how can we actually put some measures around that so government can manage it.
Jenny, do you just want to make a quick comment?
Look, I just wanted to make the point that I think worldwide, actually, at the moment, there's probably a move with governments to, sort of really look at this notion of tight control, loose control. So we have very loose control over the dollars. Yes, we will allocate money, but much tighter control about the outcomes that we want to look at. And there are different terminology used. There's that tight, loose control notion. There's the notion of outcomes brokering, or whatever. Different governments are using different titles, but acknowledging the fact that this is not something that one service sector can do. This is something that many of you will come from different sectors, different services, and how do we actually approach early intervention in that sort of generic way earlier in the life course? Which is the workforce that's actually going to do that? How do you change the culture of a school? I think, we're working very hard to try and look at how we change the whole of school approach towards looking at some of these issues, at how we bring in services to work with us, not necessarily at a tertiary level, but at a secondary level. And some of you may well be aware of the CASIA program, which is CAM services, Child and Adolescent Mental Health Services, coming into schools at grade 2 level to really work with children at the school, with their families, looking at some very, much more sort of earlier behavioural issues rather than the really entrenched mental health issues later on in life, and showing some good intermediate sort of effects at the moment. It's very early on in the life course, but my issue is when push comes to shove and we're talking about how we fund this, when we're talking about sort of these generic, non-specific kind of approaches that is about multidisciplinarity and is about child and young person and family focused and is about whole of settings approaches, how do we bring the services together to do that? And I think that's actually very challenging.
Sorry, can I just say, I think also we're starting to see things like social impact bonds. We're starting to see other mechanisms that can bring other sectors together.
Can I just have
Question, go Phil, very quickly.
Just one little one. What we did in Reconnect was the first social program in Australia to actually build into contracts a requirement that those receiving funding undertook action research as a key component of their service delivery. In other words, if a contract regime is going to be able to deliver services into environments of complexity where the models of service can't be understood in advance that will work in a particular local context, then you've got to introduce process accountabilities into that mix, and not just, you can specify outcomes, but you can't specify methods, as Jenny was saying. So you need something to deal with the governance requirements there. In Reconnect, and it has worked significantly in every evaluation, have said the action research, which is about people asking questions, setting up an inquiry culture that's about how you do partnership, who do you need to join with, how do you need to do the business if it's going to achieve the outcomes, those process outcomes embedded in contracts almost seems counterintuitive, but it's actually the way to go. Therefore, what you do is you release the energy down locally to be able to get on with the business of working out great solutions in local contexts where only those people can work it out, but you have a process accountability that means the governance requirements that government have to meet can also be met.
And Reconnect's a fantastic example because it's one that we know works. There's been claims made that it's responsible for some of the reductions in youth homelessness over the last decade. However, it hasn't been rolled out, which is one of the video questions. But we're going to go on to somebody who's in the room.
Thank you. Given the emphasis at this conference, quite rightly, on education and its links to health, I'd like to go back briefly to the discussion on reading recovery. Stephen rightly pointed out that children arrive at school with very different levels of readiness to make the transition to literacy. But we seem to forget in Victoria that the first year of school is called prep, which is a word that's short for preparatory. And I would argue that it's preparatory to nothing because that is the ideal universal early intervention prevention opportunity to try and get some equalisation in the unequal levels of ability that children bring to school. But regardless of where they are developmentally, we expect them all to meet the same benchmarks by the same point in time. And then when they don't, we say that they've got a reading disorder purely because we're not taking a proper developmental perspective in how we're managing the transition to literacy. In health, we have a notion of iatrogenic illness that's created by medical mishap, and I'd argue that we need to be talking about edugenic reading disorders because of the way that we approach the transition to literacy in a way that's not sensitive to developmental principles.
Does anyone want to make a response? Stephen, Janet?
So, I agree that there is a failure, in a sense, to project forward. I mean, there is an attempt through the government initiative and supported through funding to deliver the preparatory year as one in which the smaller class sizes, much more teachers who are more prepared, are better in a capacity basically to better connect with kids and their needs at that point. And the problem is that the scale of difference when we've got a school system that's divided public-private, that has different levels of funding, and in a sense a lot of our funding within the school system is targeted to the wrong groups, and so that it tends to accelerate gaps rather than reduce them. And over those first few years there is an attempt to in a sense, promote a better transition into literacy for those who have fallen behind. But there's just not enough resource, and it's not sustained in a developmental way in the way that you're arguing.
And we're going to go to one more question at the back.
Thanks. I'm increasingly concerned about the conversation that has stretched it to children and not talking about young people. Charles talked earlier about the importance of ethnography, and there are some communities that actually need that continuum of care, but it actually denies the fact that adolescence is a distinct period and that we should be just talking about young people and the things that impact on them simply because they turn into teenagers and a whole range of things happen to them, and that they need services particular to those needs at that time. And when we're thinking about comparing the children's early intervention, then that's great. We'll actually take the holistic maternal and child health nurse stroke youth worker in every neighbourhood, and we'll also take the peer-to-peer learning that happens in playgroups. We'll take all of that funding and we can replicate early intervention for young people in adolescence.
Go Robin. All right. Let's do another video question.
My question is, how can early intervention be coordinated so that young people and their needs are central?
I guess the question really is about where's young people in this conversation, which I think is part of Robin's comment as well.
I think it comes back to how do we design our services to make them easy for young people to get to. So there is a notion of a no wrong door or one door policy or whatever you want to call it, where it doesn't matter whether a young person comes to, in inverted commas, with a mental health problems or a drug and alcohol or a vocational problem or a health problem, that wherever they come should be able to respond by being able to sort out what needs to happen rather than turning young people away and saying, no, not us, go to somewhere else, which is historically how our services have been. They've been silos with particular siloed funding, siloed outcomes, siloed KPIs that has made that integration very difficult. I think an example, and Paul mentioned earlier, is actually Headspace trying to get away from that siloed notion and trying to say, well, this is a place where any young person can come regardless of their problem. Little problem, big problem, any problem. And an example of a way of making it youth-friendly, if you like, and is to think about the medium with which do you deliver a service. And eHeadspace has been going now for about 12 months. There's been 5,600 registered individual users of eHeadspace, which is quite astounding. In the month of May, there were 900 unique users, 300 were repeat users and 600 were new users. So young people will actually use a service that works for them. I think that's what that's telling us, rather than designing services that just that struggle to be attractive. And I come back to this notion of how do you assist young people to get help? And our services actually often act to, I suppose, almost deter young people from seeking help.
I mean, I think it's a common theme that I've seen through this conversation, which is the rigidity of our service system. I mean, it's my view that service system's over-engineered, and I don't think it's right to talk about it as the way it has been historically. I think it's the way it has been over the last decade, or maybe slightly more, pre the current very engineered current human service system, which we've been engineering more and more in order to manage demand, but also focus services to the people who are most in need, creating more people who are most in need by focusing the services in that direction. We've been making it more and more rigid, and I think in Victoria we've got another very scary big step in that direction with the mental health PWSS reforms and the AOD reforms that are coming through. So, I mean, I think that's a really interesting question around, early intervention as a broader space for young people to be, that's not necessarily around a particular type of problem that they have, and I think that it's an interesting conversation to have. Do you want to just very quickly make a comment, and we're going to...
Well, I just want to make the comment that I think help-seeking behaviour, as you say, Sandra, is important, but how do you actually encourage young people to access services? One of the things that we've been looking at is how do you use a universal platform to actually teach some of these things, or how do you also help young people to learn these things? So we're looking at developing help-seeking behaviour, incorporating help-seeking behaviour into curriculum, actually, for high school students. So the only other thing I did want to say was in response to you, Janet, right at the very beginning of this, it's all over by the age of 6, which, we hear a lot. I mean, the evidence now suggests very strongly that that's actually not true. And, outside of that early childhood Heckman graph, the other most single cost-effective intervention in society, I guess, is Year 12 completion, and that's really around diverting young people from the criminal justice system, diverting them from unemployment, etc. So, whatever we can do that actually, and intervention and early intervention during adolescence is actually very crucial. There's very strong evidence for programs that help support positive youth development. And I guess my question is, how do you turn this into a positive thing, rather than a negative thing about addressing risk? And that is about, how do you actually help young people be heard, be valued, contribute to their society in a way that is meaningful to them, encourage help-seeking behaviour, encourage them to look after their own, and give them the skills to actually participate and contribute as they for the young person in their life lived, and also in terms of their potential for the future. And I guess that's where our thinking is currently sitting in terms of how we strategise for our programs and our approach and how we drive school culture, sort of moving into the future.
And unfortunately, that's where we're going to have to wrap up. But it's a good place to wrap up because it's actually about, I think, talking about good youth practice and good youth service development. So how do we work with young people holistically? I hope you've enjoyed the session. We had a few more video questions that we didn't get to, but I'd like to thank Deb, Hasna, Hannah, Hasna, Andy and Jess for their contribution, willingness to do that, and for all of the panel members. Thank you.